Hello, my name is Brittany Roten, and I am going to do a talk on diverticulitis for Biology 139, Human Anatomy and Physiology 2. So diverticulitis is a common gastrointestinal disorder. It has gained a lot of attention recently throughout the years. It is a condition that is characterized by inflammation of small pouches that are called diverticula and that form on the wall of the colon. It is considered a progressive disease involving different ages. It can now affect just about anybody, where in the past it was believed to have only affected the elderly. Diverticulitis differs from diverticula when inflammation occurs. Um, so, some signs and symptoms of diverticulitis will range from mild discomfort all the way to a severe illness, depending on where the inflammation will depend on what signs and symptoms you might notice. These could be something as simple as never finding anything out until you begin bleeding, to noticing some other complications like abdominal pain on the lower left side, constipation or diarrhea, fevers or chills, and nausea or vomiting. And the thing with these symptoms is that they're very common to a lot of other diseases, which can make it really hard to diagnose. There has been little research on the actual cause of the disease. Several factors have been believed to increase the risk of diverticulitis. There are specific genes that will increase the probability, like bacteria or stool forming in the little sacs of the diverticula, changes in the microbiome of the intestines, issues with tissues, muscles, or nerves in the colon, and also immune system problems. So anybody that has an autoimmune disease are more likely to develop diverticulitis as well. Common lifestyle factors include diets low in fiber or high in red meat, lack of physical activity, NSAIDs or steroids, obesity, and smoking. Those all are said to increase the risk. So obviously, cutting those out and doing the opposite would be the best case scenario for preventing it. There are a couple options of diagnostic testing available. Sometimes this is only found out through like x-rays and colonoscopies for other issues that you may have, but it could also be determined through a thorough medical history, a detailed physical examination, or blood, stool, or imaging testing. And each doctor kind of depends. Um, they determine which test they want to perform based on like what they're familiar with. So treatment will depend on the severity of the signs and symptoms, depending on whether it's been identified as complicated or uncomplicated will also determine the route. Uncomplicated diverticulitis can typically be treated at home with antibiotics and liquid diets, but the Mayo Clinic has determined that like IV antibiotics, tube insertions to drain abdominal abscesses, and possible surgery could be the best treatment plans for complicated diverticulitis. And if it's bad enough, removing part of the colon could also be a treatment plan for preventing it from occurring again. We talked a little bit earlier about the high fiber or low fiber diet. Reading the nutritional facts label is really important for the diet at home. So you would want to talk with your healthcare provider or dietitian to assist you in managing your symptoms. There's not really any specific foods that you should avoid, but eating foods higher in fiber is strongly encouraged. So the prognosis of diverticulitis is usually pretty excellent. Only in rare circumstances does a patient um, de develop life-threatening complications, and that's usually if a bowel perforates or ruptured abscess happens, and those are very rare. So most patients can be fully treated and quickly resolved, avoiding overall life expectancy issues. So overall, that is diverticulitis, the signs and symptoms, causes, diagnostic treatments, or testings, treatments, the diet, and the prognosis. Um, the main thing that you should take away from this is that early diagnosis is key. So make sure you stay on top of all of the testing that you need to do and get your annual health screenings each time. Thank you guys.